Hello everyone, this is Dr. Suresh Patil. I am a joint replacement surgeon with 15 years of experience practicing in the United States, and I am currently practicing in Pune. I am the only American board certified joint replacement surgeon practicing in Pune. I specialize in robotic and revision joint replacement surgeries as well as minimal invasive hip and knee replacement surgeries. Today I'm going to talk about osteoarthritis of the knee joint, which is a chronic condition of the joint characterized by a breakdown of the cartilage, which is a protective cushion at the end of the bones. And in osteoarthritis, you see breakdown of the cartilage like you can see in this picture. So what are the features of osteoarthritis? Osteoarthritis causes certain changes in your joint. The number one changes is a cartilage breakdown. As you can see here, this is a normal cartilage that covers the end of the bone, while osteoarthritis causes breakdown of the cartilage. That's the number one changes you see in the bones. Second changes is a osteophyte, that is a bone spur that comes at the end of the joints. The third changes is a synovial inflammation that causes swelling and fluid inside your knee joint. And the last and most important changes is a loss of function of the joint. That means you cannot perform the normal activity that you routinely perform regularly, and it causes significant disability in the patient who has a significant advanced osteoarthritis of the knee joint. So what are the early signs of osteoarthritis? The early signs of osteoarthritis include pain with activity, then stiffness or reduction of the joint range of motion. Then you will see swelling and inflammation around your joint. You will feel a tenderness, that is a pain when you touch your joint, followed by grinding sensation when you move your knee joint. And sometimes you feel an instability, that is a giving way when you stand or climb stairs. So those are the early signs of osteoarthritis. So when you see this sign, please consult physician or get the radiographs or x-ray to know more about the stages of osteoarthritis or how advanced is your arthritis. So what are the risk factors of osteoarthritis? The most common risk factor is the age. You commonly see osteoarthritis in an older patient who is more than 50-year-old. The other common risk factor include gender. That is, female are more prevalent to get osteoarthritis compared to the male. Then obesity plays an important role in osteoarthritis. If you are obese or more weight, then you are putting more load or weight on the joint, which causes early wear and tear of the cartilage. Then the next risk factor is an injury. If you develop any injury or fracture around the joint or any meniscal injury, you undergo a surgery which causes early wear and tear of the cartilage and early arthritis of the joint. Then repetitive injury of the joint, also a risk factor for the osteoarthritis. And genetics, that means family history of osteoarthritis, is another very important risk factor for the osteoarthritis. So what are the stages of osteoarthritis? Before we start the stages, we should know what is the normal cartilage of the joint. As you can see here, this blue part indicates the cartilage of the joint. That is a cushion at the end of the bone of the joint. So in a normal patient, this cushion absorbs the shock or all the forces that you carry while you walk or while you run. While in a degenerative joint disease, that is osteoarthritis, you will see the breakdown of that cartilage or a cushion. In an early phase, you will see a thinning of the cushion at the end of the bone. In the advanced stages, you will see a complete wear and tear of the cushion, and you will see the bone ends at the end of the joint. It is like a wear and tear of the cushion on the tire. So initially you will see some wear and tear of the thread of the tires, and eventually those thread will worsen and will cause a complete wear and tear of the thread, and you will see a flat surface of the tire. That means that indicate similar like an advanced arthritis of the cartilage. That is advanced osteoarthritis of the knee joint. So does all the arthritis of the knee joint need a surgery? The answer is no. In the initial phase of osteoarthritis, you can consider non-surgical management of the arthritis like lifestyle modification that include weight reduction and avoiding high impact activity like running that will help you to reduce the joint stresses. The next most important factor is physical therapy, then medications. You can consider short course of anti-inflammatory medication that will help you to reduce the pain and inflammation inside the joint. But be aware about side effect of these medications. If you take this medication for long term, it can causes damage to your kidney, as well as it can causes gastritis, that means acidity of your gastric acid. Then you can consider injection. It is very commonly performed procedure in the United States. We commonly perform injection in the joint. There are two types of injection. One is a cortisone injection, that is a steroid injection we are putting inside the joint, which reduces the inflammation of the joint and gives pain relief significantly for approximately 3 months or maybe longer. The next injection is a hyaluronic acid, which is like a lubrications that we put inside the joint. The second injection commonly works good in the early phase of arthritis, and it does not work if you have advanced arthritic stages. Then you can consider different kind of braces. For example, if you have arthritis only on the one side of the joint, then there are specialized braces we can make that transfers the load of damaged part to a normal side of the joint and help to reduce the pain while you walk or while you perform routine activities. So these are the non-surgical options you can consider before you consider discussion for the surgical treatment options. So when do we need to think about knee replacement as options? We already talked about non-surgical options for the knee arthritis. When those options are not helping you or not controlling your pain, then you should think about knee replacement as options. So what are the indications? What are the signs that you should consider knee replacement? The most common signs include persistent disabling pain that is not responding to non-surgical options like medications, injection in your knee joint, physical therapy, and bracing. And this pain is affecting your daily living activity. That means it affecting your walking, climbing stairs, standing, and it also awaken you at night from the sleep. That means you are getting the pain at night. That indicates a severe disease causing constant pain even at night. Then on a radiograph, that on an x-ray you see a severe arthritis, you will see that your bone ends are touching each other, they are kissing each other. That means there is a protective cushion between the bone ends is worn off and you developed a severe arthritis, and those are the signs we see on the radiographs. And in this situation, there is no other option other than knee replacement will help you to improve your quality of the life. Does knee replacement required in all the patients? No, it's not a life-saving surgery. It's a quality improvement surgery. Means it will improve your quality, it will improve your walking, it will improve your pain, it will improve your function, and indirectly helps you to feel healthy and indirectly help you to feel happy. So knee replacement option is very important when you have severe disabling pain, not improving with any medications or any non-surgical options. So we talked about the osteoarthritis of the knee joint. We also talked about the common signs and symptoms as well as non-surgical option and surgical option. So briefly to summarize, initially you should start non-surgical options, that is a pain medication. You can consider injection, those are temporary injections, physical therapy, and different kind of braces. But if these medications or non-surgical options are not helping you to reduce your pain and it's affecting your daily living activity and the pain is persistent and severely disabling your routine activity like standing, walking, climbing stairs, then you should think about surgical options. When you are significantly disabled, I will recommend not to delay your surgical options if you are healthy enough to undergo joint replacement surgeries, because this is a permanent damage or permanent changes in your knee joint, and these changes are going to stay with you and they are going to get worsened with the time. So don't suffer too long with the joint pain and don't suffer too long with all the symptoms that we just discussed and delay your surgery hoping that they will improve their own. Once you reach to the advanced stage of osteoarthritis, the only options you have is a joint replacement surgery. So don't delaying joint replacement surgery, you are just going to suffer more, you're just going to delay your activities that you enjoy during your active lifestyle. So consider discussion with joint replacement surgeon whether you are a candidate for joint replacement surgery or not. But definitely Make sure in the early signs of osteoarthritis or early stages of osteoarthritis, you should consider non-surgical treatment options, which will delay your total knee replacement surgeries for longer time. So we just talked about non-surgical options and surgical options. We also talked about when you should consider non-surgical option and delay your surgery. And that's our first goal and treatment option should be. And when you are significantly disabled or suffer, then you should consider knee replacement. So if you have any question or concern, please reach out to us and please do subscribe our channel so we can create more videos for educational purpose. Thank you.